Thanks for joining this talk on accurate, persuasive, and effective communication in healthcare relationships management. That's quite a mouthful, but the good news is communication is something we all do every day. The challenge is doing it well, especially in high-stakes healthcare environments. As nurse leaders, your words don't just fill space. Persuasive communication moves people, changes systems, and can even save lives. It's a key part of transformational leadership, which is very powerful when done correctly. This lesson will help you refine your ability to report information accurately, persuade effectively, and build trust across teams. We'll cover both the science and the art, blending data-driven approaches with real human connection. You'll see how communication can turn resistance into collaboration and confusion into clarity. And yes, we'll also discover that good communication can actually make meetings shorter. And who doesn't want that? We'll dive into the foundations of persuasive communication, the core principles every leader needs. We'll look at how to write and deliver formal and informal reports that people actually want to read. No more snooze fests. Next, we'll explore how to build a culture of transparency where staff feel safe to speak up. We'll then move into advanced strategies for influencing policy and driving change. After that, we'll practice applying these strategies in real-world scenarios. By the end, you'll not only understand the why of persuasive communication, but also the how. And you'll walk away with tools you can apply immediately. In healthcare, communication isn't just about exchanging information. It's the lifeblood of safe, effective care and systems operations. Persuasive communication is what secures funding for new initiatives, drives policies that improve systems and health, and helps build interdisciplinary consensus. It also contributes to psychological safety, encouraging staff to communicate openly, without fear, like we discussed earlier. And don't forget the importance of translating clinical jargon into normal language. The research is clear. Organizations with strong communication cultures have fewer adverse events and higher patient satisfaction scores. So, persuasive communication is not about being pushy. It's about aligning people, resources, and ideas toward common goals and better patient and organizational outcomes. In short, it's not a nice to have, it's a need to know patient safety strategy. At the core of persuasion are three timeless principles: logos, pathos, and ethos. Logos is about logic, facts, data, evidence. And in healthcare, that means things like cost-benefit analyses and research findings. Pathos taps into emotions, helping us connect with others' values and lived experiences. Think patient stories that remind us why we entered this profession in the first place. Ethos is about credibility. People will listen if they trust you, so your professional expertise and ethical transparency matter. The magic happens when you balance all three: numbers that prove your point, stories that move hearts, and credibility that inspires confidence. Ignore one of these, and your message risks falling flat. Remember, even the best bar graph can't compete with a powerful patient story if your audience doesn't trust the messenger. Let's be real. Most reports can be as exciting as watching paint dry, but they don't have to be. A compelling report is engaging and has structure, clarity, and a touch of persuasion. Start with an executive summary, a one-page highlight reel for busy leaders. Then clearly state the problem and why it matters. Visuals are your best friend. Well-designed charts and graphs can say more in 5 seconds than 3 paragraphs of text. Your recommendations should be specific, actionable, and aligned with stakeholder priorities. And don't forget to include things like cost-benefit analyses and expert testimonials. These make your arguments and ideas stronger. Think of it this way: your report is less about dumping data and more about telling a persuasive story with evidence. If there's one tool that can instantly boost your communication impact, it's data visualization. Charts and graphs aren't just pretty pictures, they're shortcuts to understanding complex ideas. The key is matching the right chart to your message. Bar charts for comparisons, line charts for trends, and pie charts for proportions. But here's the golden rule: simplify ruthlessly. Strip away anything that distracts from the main point. Nobody ever said, "Wow, those grid lines changed my life." Use color, size, and placement strategically to guide your audience's eyes to what matters most. Done right, your visuals don't just inform, they persuade. They make your audience say, "Oh, I get it," without you even having to explain. In healthcare, silence can be dangerous. I know we've discussed it before, but when staff are afraid to report near misses or errors, the organization misses valuable learning opportunities. Too often, hierarchies, fear of blame, or siloed communication keep people from speaking up. That's where nursing leadership comes in. Creating psychological safety is paramount. Leaders who admit to and share their own mistakes, celebrate good catches, and build non-punitive reporting systems send a powerful message. Reporting is about learning, not punishment. Errors should be framed as opportunities for system improvement, not personal failure. When your staff members feel safe, they're more likely to speak up, which leads to better patient and systems outcomes. The culture shift starts at the top, with you, modeling honesty, transparency, and vulnerability. One size definitely does not fit all when it comes to communication. As you know, the way you present to a board of directors is not the same way you talk with bedside nurses or patients. The most effective communicators can flex their style, sometimes called code switching, without losing consistency in their core message. That might mean using detailed reports with administrators, while sharing stories and examples with frontline staff. It's about adapting, not performing. You're still authentic, but you're meeting people where they are. Think of it as being multilingual in healthcare languages. All nurses really are the experts in this by education and professional experience. The better we adapt, the greater our persuasive impact. Policy change might sound intimidating, but it's really just persuasion at a bigger scale. Start with a compelling narrative. Pairing patient stories with solid data makes policy impacts real. Next, think coalition building. Find allies who share your goals and amplify your voice. Tailor your communication to each decision maker. What moves a legislator isn't always what motivates a hospital administrator. Persistence matters too. Polite but consistent, assertive follow-up keeps your issue on the radar. Timing is also key. Aligning efforts with budget cycles or legislative calendars can make or break your success. A great example is the American Nurses Association's campaign for workplace violence prevention. They used these exact strategies and achieved bipartisan support. Remember, policy change doesn't happen overnight, but strategic communication keeps the momentum moving. As you know, healthcare is a team sport, and building consensus is like coaching a winning team. First, start with common ground. Everyone can certainly agree on things like patient safety, quality, or access. From there, as a leader, take time to patiently listen to all perspectives. People support what they help create, so invite their input. Ask clarifying questions and really listen to understand concerns. Then, move to co-creating solutions, instead of handing out top-down directives. When stakeholders help build the plan, they also take ownership of it. Finally, don't skip the simple but critical step of documenting conversations and agreements, like a follow-up email. That's how accountability sticks. Done well, consensus building transforms resistance into collaboration, and meetings into problem-solving sessions that actually feel productive. Imagine that. Technology can be your best ally or your worst enemy in persuasive communication, depending on how you use it. Digital tools give us incredible ways to share information, like we mentioned before, but we need to match the right tool to the situation. Synchronous communication, like in-person talks and virtual video meetings, is great for urgent or complex topics, while asynchronous options, like secure messaging, like email, work for updates that can wait. Always succinctly structure your digital communication so the critical information comes first. No one should scroll 3 screens before finding the important part. Accessibility also matters. If staff can't log in or navigate the platform, the tool fails. Use familiar forms of digital communication that help to prioritize patient and staff confidentiality. When choosing systems, prioritize HIPAA compliance, integration with workflows, and user-friendly design. Analytics are also powerful. They let you track how well your communication is landing. The bottom line, technology should simplify and protect communication, not complicate it or make it vulnerable. Here's a hard truth. Just because we sent the email doesn't mean anyone read it. How many unread emails, texts, and/or voicemails do you currently have? None of us can keep up and respond to everything that flies our way. That's why evaluating communication effectiveness is so important. Quantitative measures like response rates and time to decision show us as people are engaging with our messages. Qualitative feedback tells us how clear and relevant those messages were. Process analysis digs even deeper, helping us spot barriers and compare which channels work best. Mature organizations don't just measure once. They build communication review cycles into their workflow. This way, communication strategies improve continuously rather than staying stuck. Think of it like a quality improvement project, except the focus is on communication outcomes. Because at the end of the day, if your message isn't understood, it might as well not have been sent or said. Let's look at a real-world example from Memorial Regional Hospital. They had some big challenges: underreporting of safety concerns, siloed communication, low engagement with leadership, and poor adoption of new clinical guidelines. Sound familiar? Their solution wasn't a quick fix. It was a full communication overhaul. Leaders were trained in persuasive communication. They introduced non-punitive reporting, redesigned reports with better visuals, and created structured feedback loops. Within 18 months, safety reporting increased 156%, communication scores improved 42%, and adoption of new guidelines sped up by 87%. That's not just a little improvement, that's transformation. And the best part, other hospitals in their system adopted the same model, spreading success across the board. It's proof that communication can literally change organizational culture. In fancy scholarly language, they disseminated their results to effect widespread change. So, this was a lot. But what's the big picture here for accurate and persuasive communication? First, blend data with narrative. Numbers convince the mind, and stories move the heart. Second, tailor your communication to your audience. The same message needs a different delivery depending on who's listening. Third, create psychological safety by celebrating reporting and focusing on systems rather than individual blame. Fourth, remember that communication is a skill you can measure and refine, just like any other leadership competency. Strong communication doesn't make you sound better. It improves patient safety, staff engagement, and organizational outcomes. Think of it as leadership's superpower. And if you ever doubt the power of communication, just remember, even the best ideas go nowhere if they're not communicated well. In other words, how you say it is just as important as what you say, if not more. Thanks for listening.